The human brain was never designed to thrive in a smog-choked world. Yet billions of people now live in environments saturated with airborne pollutants, fine particulate matter, nitrogen dioxide, heavy metals that quietly infiltrate the nervous system, inflame brain tissue, and over time, erode cognitive function. While the health risks of air pollution have long been associated with lungs and hearts, a far more expensive and insidious consequence is now surfacing: pollution-induced dementia. And make no mistake, this isn't just a medical problem. It's an economic disaster in slow motion. New estimates from global health economists show that the rising tide of pollution-related cognitive decline is poised to cripple public health systems, gut productivity, and generate long-term social costs that most governments have barely begun to acknowledge. According to the Lancet Commission on Pollution and Health, air pollution already contributes to an estimated 9 million premature deaths per year. But the cognitive toll is harder to quantify, and in some ways more devastating because it represents years of care, not just early mortality. People don't just die. They forget. They decline. They require supervision, institutional care, and long-term medical support, often for decades. Let's be blunt. Dementia is one of the most expensive medical conditions in the world. In 2024, the global cost of dementia was estimated at over $1.3 trillion annually, and it's projected to double by 2050 as the population ages. Air pollution is now being implicated as a modifying factor, meaning that even a small contribution to dementia risk translates into a massive financial burden. A 10% pollution-related increase in dementia incidence would, by some estimates, add hundreds of billions of dollars in care costs over the next 25 years. Where does all that money go? Not to cures, because we still don't have one. It goes to long-term care facilities, home health aides, hospitalizations after falls, psychiatric care, and a litany of chronic complications like malnutrition, incontinence, and depression. Then there's the unpaid labor, family caregivers, often women, leaving jobs or reducing hours to care for relatives with declining cognition. These indirect economic losses are estimated to rival, or exceed, the formal healthcare expenditures themselves. And unlike some health burdens, pollution-linked dementia doesn't scale equally. Low- and middle-income countries, where air quality standards are often unenforced or non-existent, are expected to see the steepest rise in pollution-induced cognitive disorders, while lacking the infrastructure to manage them. Already strained healthcare systems in megacities across South Asia, Africa, and Latin America will be crushed under the dual burden of toxic air and aging populations. There are no public nursing homes in many of these regions. When elders lose cognitive function, their families absorb the shock, emotionally, financially, and logistically. The result is intergenerational economic drag, often pulling entire households into poverty. Even in wealthy nations, the price tag is growing. Medicare systems in the US, NHS trusts in the UK, and state-sponsored elder care in Europe are all grappling with rising costs from dementia cases that, in many instances, could be partly preventable through stricter pollution controls. But because air pollution is still largely viewed as an environmental problem, not a neurological one, the funding, policy urgency, and cross-departmental coordination simply isn't there. The most tragic part? We know how to fix it. The economic case for reducing air pollution has already been made, over and over. Cleaner air leads to lower rates of heart disease, fewer asthma attacks, better school performance, and yes, less dementia. Every dollar spent on air pollution control returns an estimated $30 to $40 in health benefits, according to the EPA. Yet progress is patchy, fragile, and frequently rolled back by political expedience or corporate lobbying. So, what happens if we don't act? We're staring down a future in which millions more people will slip into cognitive darkness not because of aging alone, but because of the chronic, preventable exposure to neurotoxic air. And we will pay for it. Through higher insurance premiums, through exploding healthcare budgets, through shrinking labor forces and lost productivity, through emotional devastation that no dollar amount can ever really measure. This is the true cost of air pollution, not just dirty skies, but disintegrating minds, and with them, a silent financial avalanche. Every unregulated factory, every lenient emissions policy, every treeless city block isn't just polluting the environment. It's drafting a bill that will come due in hospitals, nursing homes, and family bank accounts. If clean air was priced into healthcare policy the way drugs are, there would be no question of its value. Instead, we continue to externalize the cognitive cost of pollution and pretend the brain isn't part of the body. The brain is the body. And right now, we're poisoning it economically, irreversibly, and globally.